Good afternoon, everyone, from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and it's Wednesday, 5 p.m. local time, when we have our experts answering your questions about COVID-19. Today, I'm pleased to be joined again with Mike and Maria, and we also are going to address, ahead of the World Children's Day, how this pandemic has impacted kids around the world. And we thank everyone who already shared the questions on our social media channels from their kids. Still, please send your questions if you're watching us on Twitter using hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, please ask your questions via comment section. Also, please know that the team is moderating questions, including to ensure that those on COVID-19 are highlighted first. Thank you, everyone, and thank you, Maria and Mike, for your time to be with us again to answer the questions. I think we have some good news to share today, not COVID-related, but still another emergency outbreak that's over. So, Mike, I would give you the floor to share the good news.
Well, many of you may have heard this, but today the government of the Democratic Republic of Congo declared the end of the 11th outbreak of Ebola virus disease in DR Congo. It's really, really good news, and it's a real testament to the mainly local workforce. Again, WHO and many international agencies were involved in assisting, but the vast bulk of this response was managed by local doctors, nurses, epidemiologists, logisticians, hygienists, sociologists, anthropologists, and others. And we had 130 cases in total, but only 55 deaths and very low death rates amongst people getting to the emergency treatment units. I think the whole team, led by the government, 43,000 people were vaccinated, 9,000 frontline health workers, 26,000 contacts were followed for 21 days, 15,000 lab tests were done, over 47,000 people were vaccinated during the response. And that's with a vaccine at minus 80 degrees, the ones you're hearing about now for COVID. Again, our RTEC containers that were developed in collaboration with the Bill and Melinda Gates Foundation can carry thousands of vaccine doses at minus 80, even into the bush. What was interesting in this, very challenging in this response, I think, was that the response in eastern Congo, that you'll remember, was very much in a conflict zone, a wide area conflict zone, and that had its own challenges. This outbreak was across 13 health zones, spread in communities scattered across rainforests, with huge distances, massive difficulties, no roads in many cases, huge problems in accessing communities, and required a completely decentralized approach. We literally had to put the teams in the field and leave them there because the logistics of coming in and out were just unmanageable. So this required a much more adapted approach. It required a much more partnership with the community, with local leaders, with local youth and women's groups, a decentralization of surveillance and empowerment of community, a bigger focus on education, communication, and passing on that important knowledge to people. So again, we've learned more in this response about how to do these kinds of responses better. I think we've learned, like in the previous outbreak, how to use vaccination at scale to stop an epidemic. We've learned how to treat cases better and get better outcomes, and we've applied a lot of that learning in the COVID response, and now we can apply the COVID learning in the next Ebola response. So we're seeing a good synergy between all of these different activities. But again, just to say, the real heroes in this are the communities. Those communities in those most rural areas, they've protected the world from this virus once more. Their actions have stopped this virus moving. The frontline actions of doctors and nurses have stopped this virus moving and becoming a regional or a global threat. And we owe them a debt of honor for their commitment. I hope the world just sends out a cheer to the people of Ecuador, to the health workers of Ecuador, for the work they've done, with some support from us, of course, but the work that they've done has been truly outstanding.
Thank you, Mike, and I think this is a great opportunity to once again say thanks, health heroes in DRC, but also to all health heroes around the world who are protecting us and fighting this virus on front lines. When I say this virus, I meant COVID-19 virus. Maria, there were some headlines in recent days that there have been an outbreak here in our premises and headquarters. Maybe you can just clarify what's the situation here.
Yes, so we haven't had an outbreak here on the premises. I mean, we have people that work, we have thousands of people that work for WHO here in Geneva and all over the world. If I remember correctly, 6,000 or 7,000 people that work for WHO all over the world. And we monitor their health, you know, just like every other workplace all over the world. We have had cases that are amongst staff, and some of those staff are based here in Geneva. Now, since the beginning of the pandemic, and I think, you know, when the situation in Europe, where there was an increase in cases in the general community, we started to take some precautions and make some restrictions of how many people are in the building. We have had cases amongst staff who have had access to the building, somewhere around 30 or so individuals. And so there are a few cases that are reported each week, that are identified each week. In the last week, we had about 5 cases that have been linked together in space and time. You know, they either work together. And what we do is we do an epidemiologic investigation. We, first of all, make sure that they are okay. We make sure that they're receiving the medical care that they need, that they get a test, any support that they require. And then we do a little bit of, we ask them questions. Who did you come in contact with? And we carry out what you hear Mike and I and the Director General talk a lot about, is what's called contact tracing, where we identify who came in contact with them and then test those individuals as well. So we have had some people who have been linked together, where they've spent some time together. But what we've looked at in this investigation is that they also had other exposures. So the other thing that we do is we say, when you're a case, we said, what did you do in the previous 14 days before you got sick or before you tested positive, to investigate, so to speak, on how might you have gotten infected. And so in this this cluster, if they are indeed a cluster, there's other possible ways that they could have been infected. So we are monitoring the health. There isn't an outbreak here. There were quite some sensational headlines related to that, but all of us live in this area, and there's a lot of virus around us right now in the area of Geneva and in the cantons around where we live. And so the virus is circulating. So we go to grocery stores, we bring our children to school, we do a lot of things that are out there. We take precautions, and we keep our physical distance, we wear our masks, we have our hand gel, we do all of that. But there is no zero risk right now. And I just want to say that anyone that is infected with this virus should not be, anyone anywhere, should not be stigmatized for being infected, no matter who you are, no matter what profession you have, no matter where you live. We're in this together. We really need to support each other through this.
Thank you so much, Maria. Recently, we've heard from many followers coming from countries where the current epidemiological situation is serious, with cases growing increasingly every day, having new records, and where also capacities in ICUs is also full and filling up very quickly. So those people are expressing an anxiety and fear of getting infected, fear that they won't have someone to treat them and take care of them if they need it. And on the other side, being also scared because they can't receive any other health care that they need because of COVID. So how we can help people who are in those settings to cope with the situation, to cope with their anxiety and fear, and also what is the advice to protect themselves?
So that's a lot of questions in one, and it's a really good one. No, not at all. I mean, it's the right questions to be asking. The first thing is it depends on where you live right now, because the global situation is very different. As you've pointed out, there are a lot of places where case numbers are growing. There are a lot of places, a lot of cities and towns where hospitals are full. But there are many parts of the world where transmission has been controlled, and kids are in school, and restaurants and bars are open, and you know, people are getting back to normal life. And that's hope. You know, that's a glimmer of hope that we can do this. But in areas, I think, that are really seeing increases in transmission, the first thing is to sort of know your surroundings, know what is happening around you. There's really good data collection that is happening now, and dashboards and ways in which you can track what the virus is doing around you. And so you know how many cases are being infected, what does it look like in your local hospital. So know your situation is really quite important. When you mention fear and you mention people being scared, I think it's important that we acknowledge that that is real, that all of us have fear, all of us have anxiety, all of us are coping with uncertainty. But there's a lot that we can do to try to minimize our risk. There's a lot of things that each of us can do every single day that can minimize the chances of us getting infected and minimize the chances of our loved ones getting infected. Again, in the area that we live right now, we see a lot of increased numbers of cases. Our hospitals are very full, and I saw some headlines that our ICUs were full. We all have to make decisions every single day that manage our risk. So these are 1,000 little decisions we make every day, keeping COVID at the forefront of what we do. It shouldn't paralyze us, but we have to consider how we travel to work and whether we make sure we have our mask and our hand gel, if we go to that shop, do we need to go to that shop first of all? We are so fortunate that we live in an area where we can have food delivered, where we can, find ways in which we can reduce our opportunities to be in crowds. All of those things are really, really important. But the physical distancing is critical. In addition to wearing a mask, in addition to good hand hygiene, in addition to avoiding all of these different types of settings where you have lots of people. We need to do it all. We need to do all of those things, and that will help reduce the chances of us getting infected and reduces the chance of us passing it on.
Thank you very much, Maria.
I think it's also to go back to the equation of in those places where we see this intense community transmission and where we've seen those cases build up over the last number of weeks and where we now see intensive care units full. And our concern in this is not purely with those numbers. Those numbers are terrible, but it's the outcomes for those patients as well, because as the system comes under more pressure, doctors and nurses get more tired. The number of minutes they can spend with each patient goes down. So they're rationing their time, they're rationing their skill and their expertise, and then the outcomes for the patients start to drop. So not only do we have full hospitals, but in those hospitals patients won't do so well, and that's a secondary negative effect. So what we need to do is reduce the number of people that need to go to a hospital. There's only one way to do that right now. There's only one way to stop more people needing to go to hospital, and that's to stop more people getting exposed and getting infected. The thing you do, I don't care if you're 4 years old, 40, or 400, every one of us is part of this battle to reduce transmission. And if you protect yourself and you protect others, then the community is protected. If the community is protected, you're protecting the health system. If the community and the health system are protected, you protect the economy, you protect society. If we do those things, we avoid the health system and the ICUs filling up and the emergency rooms filling up, and we avoid the lockdowns. It's a simple equation. It's very hard to deliver, and it's very hard to sustain, especially in these winter months and everyone is exhausted. But, we need to be honest and plain. We're not there with vaccines yet. We will get there, but we're not there. And many countries are going through this wave, and they're going to go through this wave and continue through this wave without vaccines. And we need to understand and internalize that and realize we have got to climb this mountain this time without vaccines. But we've seen in other countries that when it's done properly, it has a huge impact, positive impact, and we can do this, we can get through this. And then I hope, with a lot of hard work, in the spring, we'll start to have vaccine come on stream, and then we'll have a huge extra tool. Some people think that vaccine will be, in a sense, the solution, the unicorn we've all been chasing. It's not. It's a very powerful, for those of you out there who do maths, it's a very powerful term we can add to the equation of getting rid. If we want COVID to equal zero, how do we get COVID to equal zero? Adding vaccines is going to give us a huge chance. But if we add vaccines and forget the other things, COVID does not go to zero. We need to add vaccination to the existing physical measures, being careful, and hygiene. And if we add that physical distancing and hygiene and care to vaccine, I think we will go a long way to getting rid of this virus. And I think we need to now, without the vaccine, really practice those things again. And again, I say this, it is so hard to continue to do that. It is so difficult to continue not to visit your older relatives. It is so difficult to have to stay at home if you're on a stay-at-home order. It is so difficult to have to self-quarantine if you've been a contact. But if you're a contact of a case and you self-quarantine for 14 days, you will infect nobody else. You are the end for that virus.
There's nowhere to go.
If you don't do that, you are the beginning for the virus. You are the start of the next chain or the next cluster. That's unfortunately, the brutal reality of virus transmission. You make yourself a dead end, or you make yourself the beginning of the next chain. And it is so tough. There is no other way to do it. And I hope in 100 years' time or 50 years' time or whenever it is, people look back on this pandemic. You know, we'll look at our heroes as those frontline health workers. But our real heroes are going to be those people who did that. I saw a fantastic ad from Germany the other day, and I thought it was brilliant. You know, your job is to lie on the couch. You know, yes, sir. And I know that, and it's more than that. I know so many people are out there, and youth organizations are out there. They're activating, and they're working, and they're contributing. I've never had better educators than my kids, telling me, you shouldn't be doing that, Daddy, you know. So kids also need to become activists in their own houses. They are. They are.
Oh, yes.
So sorry, I'm going on a bit here, but I think we honestly, together, as we have a conversation around this, it's really important that we put these things in perspectives, where things are not the same all over the world. Yes, there are some situations that are really difficult right now, but we have it in our power. We have it in our hands to change that reality by our behaviour and by what governments do to support that behaviour, and we need the two to come together.
Can I just add something to that? Because I've been thinking a lot about this, and like we keep thinking about this toolkit that we have. You know, vaccines will be one of the tools that fits in our toolkit. But right now we have a pretty hefty toolkit. And I know we're talking to kids, and I know that it's World Children's Day at the end of the week, but we all have a toolkit right now that's full of not magical solutions, but practical solutions that each one of us has the power to hold. So these are tools like physical tools, physical distancing, wearing of a mask, using hand gel, using soap and water. Information is a tool. Information about where this virus is, information about what is a risky behavior and what is not, what is riskier compared to what is less risky. That's information, that's power, that's tools. The other thing that many people have, not everybody, but we have the power to make decisions. We all have power to say, I choose to do this, I choose not to do this, I have to do this, and if I do, I'm going to take extra precaution. I'm going to make sure that I put in ample time to either walk if I can, if I'm in a position, or ride my bike, or if I have to take public transportation, I will do that in a safe way. Maybe I will go when there are less people. Maybe I will make sure that I try to minimize my contact with other individuals. The power to have information to take decisions to lower my risk is part of that toolkit. And vaccines will be part of our toolkit. But it's not at the expense of everything else. Therapeutics are part of our toolkit. And I think people need to visualize, young and old, that when I go through my day, I've got my backpack, or I've got my little, literally a toolkit. I can picture this. I can picture my son with his backpack thinking, I've got my power tools. I am my own little superhero. I can do all of these things every day, and it's within my control to control some of this. We're in a really, really uncertain time, and we don't know how long everything will last. We don't know. We don't have a crystal ball. But what we do know is everything that we do can change the course of the future. We have in our power right now the tools to change the course of this pandemic, and we are seeing countries do it. So you mentioned countries that are in really scary situations. We are also seeing countries that are in scary situations starting to make a little bit of a turn. We're starting to see a decline in incidence with measures that have been put in place, with physical distancing staying intact, making sure that we don't go to those crowded areas. That's turning things around, and we can continue to do that. So, please, whatever you want to visualize as your toolkit, pack it full every single day, and know that that is what you need to carry to help get us through this.
Thank you.
I think we talked about that video before, but that idea of everyone keeping in mind the locations you go to, the duration you spend there, and the intensity of the activity and the number of people, the crowding there. Because if you look at that and you think, I have a kind of a score for the week, I can go to the shops twice, or if I have to bring my kids to school or don't have to, or if I have to visit a friend who's unwell or something, you can look at that over a week and imagine it like I got to keep below a certain level of exposure to this virus. And every time I go to a crowded place, my potential exposure shoots up. But I may go to a less crowded place and spend a long time there. That may produce a very similar amount of exposure. And I can certainly walk to the top of a mountain, and I can stay there for as long as I like, and I can engage in whatever activity I want to engage in, because I'm not going to expose anyone else, and I'm not going to be exposed. So you need to understand, where am I? Who am I with? How long am I spending here? And if you look over your week and you've been spending too much time in crowded places without protection, without taking precautions, and you're engaging in activities that can expose others or have you exposed, then your risk score is going up the whole time. And you may then be exposed to an infectious dose from which you get sick and you bring it home and infect somebody else. It's not every exposure that matters. We don't really, and one of the things that's interesting in clusters is not all people transmit the disease on. We don't fully understand the factors that drive disease. We've looked at the different types of transmission. We've looked at previous immunity. We've looked at the person's general health. We look and we see all these factors have an impact. But regardless of what we look at, what we see consistently is that transmission occurs in particular contexts where people generally are in a crowded setting for a long duration and are indoors without adequate ventilation and without taking the necessary physical precautions. That can happen in a household, which is very difficult to prevent, but can be. It can happen in a bar, in a nightclub, it can happen on a bus. So as Maria said, this is really about identifying, do I need to do the activity? Can I make it more safe by taking precautions myself and changing my behaviors? And all you really need to do is get everyone in society to take that behavior to a certain level. And if everyone does the same thing, the virus just can't move. You box the virus in, as Tom Frieden says, and we got to box the virus in, give it no place to go. And that's in our power. The virus is not an intelligent biologic system. The virus is not thinking its way through this. The virus is a biologic entity that just needs another human being, and it needs that other human being quickly. Because as the virus is in the human body, you start to develop immunity to that virus. Now your system goes on the attack. And if you want to think about maybe how the virus thinks, the virus is thinking, I need to get out of here because I've invaded this body, but this body is now reacting to and it's fighting me off. I need to move. And it's that next move that the virus makes. We either make that move easy or we make that move impossible. If we can get more people to make the move very difficult or impossible, then this virus loses its capacity to reproduce itself.
Thank you, Bob. This is really great, and I'm sure that our viewers are happy with the explanations you're giving us and advice that you're giving us, how we all can help to end this, because everyone is asking when this is going to end, to come to an end. We don't have that answer, but we do have answers on how we can help to come to an end. Speaking again of exposure and anxiety, we received questions when we find out that we are contact of a contact. What do we do in those situations? And here is one particular I want to read from Ruchira Sahey Bansal watching us on Facebook. Someone I was with for the last 2 days has been tested positive today. Please advise what precautions I should take. I have a 3-year-old baby.
So we get this question, I get this question a lot, whether you are a contact of a known case or you're a contact of a contact. So if you are a contact of a known case, it's good that this individual told you, and so that you know. And what we recommend is that you go into what we call quarantine. You separate yourself from other people. Now you have a baby girl or a baby boy, I don't know what you said, but you have a 3-year-old, so you have to, of course, make sure that you take care of that 3-year-old. There's ways you should put on a medical mask. You should wear a medical mask if you're at home, if you're feeling unwell. But make sure that you keep yourself separate from other individuals. If you are feeling unwell, put the medical mask on, and then make sure that you get yourself tested so that you know if you are a case or not. And talk to your medical provider, because for anyone who's out there, I don't know your age, I don't know if you have underlying condition, but you should contact your medical provider to find out what is the next steps for you. But I think the reality of what you've highlighted in this viewer is that we all have families. We all have, what would we do in that type of situation? And of course, you have to care for your child, but there's ways in which you can make sure that you keep yourself safe. Wash your hands a lot. Make sure you keep your distance as much as you can, but of course, it's difficult with a 3-year-old. Clean surfaces. I've had many friends in the U.S. who are in the exact same situation. Where they've had to keep their kids a little bit separate. I don't know if your 3-year-old, likes to play with different games or different things, but can keep active that way. But keep yourself healthy, eat well, and drink lots of fluids and all of that, and make sure you look out for yourself as well. Yeah.
A contact of a contact as well. You don't need to quarantine if you're a contact of a contact. But like every citizen, you need to be cautious. We're all trying to stop ourselves if we're asymptomatic infecting people. So physical distance, if you do the things that stop disease transmission in the normal, keep the physical distance, wash your hands, wear a mask when you can't appropriately distance, all of those things, then you'll keep anyone else safe in the environment that you're in. If the person you're a contact of, the contact that you're a contact of, develops illness, it doesn't mean now that you're a contact of that person either, because they could develop the disease 6 or 8 days later, and you haven't been in touch with them over the 2 days. Therefore, you don't fit into technically being a contact of that individual. So again, it's important that if you can, know the status of your colleague or friend who's a contact, because if they do get tested positive, you're not necessarily a contact of that person, because you may not have had contact with them in the 2 days before they had disease onset. In other words, you may have been a contact of that person when they were uninfectious. So again, if you're not contacted by the authorities, it doesn't mean that they've made a mistake. But if in doubt, you can always contact the authorities and ask. If you do know that your friend has become a case, you can contact the authorities to say, well, look, I was in contact with this person on day X, and they will either reassure you and say, no, that's outside the period of exposure we're looking at, or they'll say, oh, sorry, yes, you are a contact, you need to self-quarantine. So again, contact tracing isn't perfect, but if we consider contacts of contacts, that's a lot of people in a society. So again, it's important. Contacts of contacts are not contacts in that sense, and don't have to self-quarantine.
This is, it's a really good question, because we get it a lot. One of the things, we need authorities to be able to carry out the contact tracing, but all of us have a role to play as well. Like if today I started to feel unwell, I would contact our staff health wellness here and let them know and get tested but then I would also personally, I would let people know. This is my choice to be able to do that. But because so many systems all over the world are overwhelmed to be able to carry out contact tracing, I know in many situations authorities are really struggling to call the cases, to find the contacts. You as an individual could call your friends and say, listen, we had coffee the other day. Hopefully you're not having coffee with your friends at the moment. But you could contact them and say, I think you may be a contact. I may be sick, and just talk through it and just inform each other, because that is part of the community, that is part of this. One of the things we see in studies that are coming out is that a lot of the transmission is happening in these small gatherings, not any more of these big mass gatherings, that we had seen in the beginning, but these small gatherings at people's homes. And these are the times where you're with your loved ones and you're with your friends. You let your guard down a little bit. Even in workplaces, there's a study that had come out recently that looked at workplaces, and people let their guard down at work because, we're family in a sense because we spend so much time together. But we have to maintain the vigilance of saying, no, I still need to maintain my distance from you. I mean, you see the way that we are seated here today. When we are not in this, we have our masks on. These small gatherings can really drive that transmission going forward, but we need to be conscious of that. And if I were to become sick or I were to become a case, I would let others know and say, I have tested positive, and therefore you are a contact and you need to go into quarantine. But there's responsibility, I think, that we all have. But this is part of this collective drive to kind of bring this to an end.
Thank you so much. I have 2 follow-up questions before we move to the questions we received from kids. So one is in particular about salons, cosmetic salons. What are the risks for bringing the virus home as a hairstylist? Does blow drying aspect can spread COVID?
You're asking me. I'm asking you both. Okay. Well, I mean, the risks for individuals are, there may be certain occupations that put you at a higher risk, like health workers who are exposed to known patients. I think anyone in an area where the virus is circulating, you need to make sure that you keep distance. Hairdressers, I know, have a close distance when they're with patients, but what I've seen, if the salons are open, I've seen that those that are going in for the, I almost said procedure, for your appointments, have a mask on, and I know that the salon owners wear masks as well. So follow the local precautions that are being advised in your area. I think that's really important. If you're feeling unwell, if the person getting their hair done is feeling unwell, you should be at home. I mean, we really need to, regardless of your occupation, if you can stay home, you need to stay home if you're unwell, and get a test and make sure then we follow all the public health actions that need to take place there. But again, it's about all of the decisions that we make, and if we have to go to work, if the salons are open, make sure you follow those local precautions that are put in place where you live.
Thank you very much. Mike, maybe you can take the next question. From Antonio Hyder, also watching on Facebook. What's the best way to change social behavior when people don't listen, contradict, and argue? What's your view on fast societal change?
If Antonio asked that question, if Antonio has the answer, he has a job, okay? Contact me with the answer to that question. Look, it is very tough. Human behavior is a wonderful thing, but it's sometimes very hard to understand what drives us. I think it's about persuasion when you're with colleagues and friends, and we've seen the arguments, and unfortunately a lot of the discussions we've had of late in many areas of our life, be it climate or politics or COVID, they become very binary, and it's good and bad, you're with us, you're against us. We've entered into a kind of a coarse dialogue on things in which we become ideologic and absolutist. And unfortunately, life is not like that. Life is about biology. It's squishy and it's messy, and there are no easy answers. So we can take a view that, well, you're wrong because you won't socially distant, or you don't believe in the vaccine. But people very often have genuine concerns. Those concerns might not come from a place of good information. They may come from propaganda, but more often than not, the person you're arguing with has strong feelings that what they believe to be true is true, and that their views and their opinions are important and they should be listened to. The difficulty is listening to those opinions when there's clear evidence that that is not the right thing to do. And it's really easy in that situation to either become aggressive, to become dismissive, and then turn it into a battle of the facts or a battle of the science, and it turns into this kind of discourse that is not a dialogue anymore. It's me shouting at you, you shouting at me, I'm right, no, you're wrong. And in my experience in epidemics and Ebola and others, it really does require stepping back and leaving your ego at the door, leaving the need to be right or wrong at the door, All that matters in the end is we can leave the room and people have had an opportunity to think or rethink. And when you have a discussion with someone else who you don't believe is behaving in the right way, don't expect them to all of a sudden come to some realization that you are now right and you're a guru and you've been right all along. How many people in your life have ever announced that to you? Most of the time behavior changes comes when you're respectful. You give people the information, you give them facts, you tell them where they can find other facts, and leave them and give them space to think it through. And if enough people are having those types of conversations, I believe society moves through a persuasive dialogue and not through an ideologic slugfest, which we seem to have reduced our societies to, across politics and even on climate change and other things. So I do think we need to find another way to have our discussions with each other and within communities. The other thing is, within our community dialogues, we've kind of lost also, I think, that ability to discuss things as communities. We've become more isolated in our own worlds, our own unitary families. We are connected through social media, and that's one of the great advantages now, is that even though we might not be physically, we have communities. And I do think we need to, again, generate discussion that is healthy and not drive outcomes, because we need to score a point to be right or to be wrong. How we do that, generate a discussion where people can access the information they need. The other thing, and I know you deal with this all the time, Alex, and the work you do with the team here, I don't believe we should go after the bad messengers or we go after the message, not the messengers. And I know you've been a great proponent of that here. Getting good information out. It's like a vaccine against the bad information. We use a vaccine to get rid of the virus. We need good information to get rid of the bad information. I don't think it's a good thing to be just saying we need to attack the message of that's the wrong message. I don't think that works in the long run. So flooding the zone, I don't know if the person is from America, but they say that in American football, don't they? Flood the zone, you know? I don't know.
I can tell you about American football.
But we need to flood that space. And if we leave vacuums are very dangerous things when it comes to attitudes and information. We need to fill the space with good information, with dialogue, and with persuasion, not vitriol and accusation. And that for me takes longer, it's more frustrating, but when change comes, it's real, and we need to shift the mores of society. I know in many societies, for example, when you look at things like driving under the influence, and for many years, driving under the influence of alcohol in some countries was entirely acceptable. How did society change from that, where you basically could put your car keys on the bar, get drunk, and then everyone expected you to drive home, to now if you walked into a bar and even showed car keys, the bartender would probably not serve you because it would be such a shock that someone would even think. How does society move from a complete acceptance of a behavior to a completely different way of thinking about something? And we need to think about consequence. And when we start to think about the consequences of our actions, if we speed, go beyond the speed limit, if we drink and drive, and we stop thinking about what speed it should be or what the level of alcohol should be, and we have all these arguments, if we think a little bit more about what are the consequences of those actions, when a mother has to bury a daughter because they're killed at a pedestrian crossing by a drunk driver, that's a consequence. And when people start to think about consequences, I think they become more reasonable in at least discussing what has led to those consequences. When you're stuck in the mire of I'm right, you're wrong, and this is a safe level and this is not, and I think we get nowhere. And the consequences right now of people not taking care are full ICUs, people dead before their time, the long-term COVID haulers who are now struggling with long-term impacts of COVID, and more people dying than need to or should die before we get to the era of vaccination. And right now in this stretch, and I would say it's at least 4 to 6 months before we have significant levels of vaccination going on anywhere, we have to get through this. And the only way we get through this is finding a way to behave that's functional and that reduces risks and actually avoids those awful consequences. And I see it every night on TV, or we see it in the newspapers, those personal stories of the loss that people have suffered. And the virus that killed them came from somewhere. It came from the community, from us, and our behaviour determines those consequences. So reasonable, respectful dialogue, push good information. Don't expect your argument to win. It's not about winning the argument. It's about changing behaviour and changing expectations around behaviour. I think if we take that approach, we'll bring more people with us on this journey. And we may win less arguments, but does that really matter?
We have this hashtag of in this together.
Yes.
And you hear us talk all the time that we're in this together. And the Director General talks about this all the time. We really mean that. I mean, even in areas that have brought this under control, I think we are in this together because we live on an interconnected planet. We share the same space. We are all people. And we need this collective attitude to say we can do this. And it is important for every single one of us. I mean, it would be very hard to find someone who is not impacted by this pandemic one way or another, either directly through losing a loved one who cannot be replaced, through either knowing someone who's lost someone, losing their job, losing the certainty of a young person, who's graduating high school and what am I going to do in my college, to I don't know anyone that isn't impacted by this. And so these individuals, we all have stories, we all have something to contribute, but this is a serious disease. This can kill. This is killing people. But at the same time, there's so much that we can do to prevent that from happening. If we can think collectively about the prevention aspect of it, because that is within our power to do, this vaccine, when it is available, vaccines, I will say, when these vaccines are available, it will, be that last thing that can help in addition to everything else that we are doing. But we need a collective energy around ending this together. And I just, we had a question the other day at the press conference, and the question was, does the vaccine, the results from the Pfizer vaccine or the Moderna, or does it give you hope? And of course it gives us hope. But I want every single person to realize, I'm the hope. You're the hope. Every single person watching is the hope to get us through this, because we have the tools to get us through this. So a vaccine makes us think in the long term, how are we going to get through this through next year? But I'm the hope, and so are you watching. And we all need to come together to be able to do this. And that is this rainbow that my son draws, all of us are, that's what we need to think. And I know that days are very hard. We've all had very difficult weeks, and for me in particular, the last couple of weeks have been really difficult. But we have hope, and I get accused of being too hopeful. But you know what? I will carry that with me every single day, because we have amazing teams that are working all over the world. There are frontline workers that get out of bed every day, that are putting themselves at risk. We have people who are canceling family gatherings, who are canceling my son's birthday, except we did 5 hours of Zoom birthday and made fools of ourselves and danced on camera. But that's a little sacrifice to make if we can contribute to ending this pandemic. What are the sacrifices that you can make? We have many holidays that are coming up towards the end of the year, and more than anything, we want to be with our families. And we don't want to be just with our immediate families, and some of us may not be with our immediate families. We want to be with our extended families. Maybe it's just not the year to do that, and that's a really hard thing to say. But these are the decisions that we're going to have to make, and these are hard decisions that we need to make. So.
Thank you very much, Maria. We are running out of time, but I think we need to address the questions that we received from children, actually from parents who shared what are the most asked questions from their kids in this pandemic. And on Friday is World Children's Day, and you just said everyone is affected. That includes our children. Maybe we can you just mentioned your son's birthday was recently, he turned 10. How do you explain this situation to your child to understand the danger of this virus, but on the other side as well, that he's not in fear?
Well, all of us who are parents, we get really tough questions from our kids, because they're blunt, they're direct, and there's nowhere to hide from any of those kinds of questions. And so for my son, I have two children. I have one who's almost 2 years old, who's oblivious to this and just plays with cars, and I'm thrilled that he's oblivious to all of this. And he's a happy little tyke. My older one, who just turned 10, he knows what's going on around him and his friends. And for him, he's seen the evolution of this from the beginning. I think the scariest thing for him in the beginning was, first of all, I just wasn't around. I was really largely absent. And then when I went to China for a few weeks, he was really scared that I wasn't going to come home. Because you can't see viruses. You can't see it, it's something happening somewhere else. So we talked about it. You know, he knows what I do, and I've gone to his school before and described that some of the work that we do are these disease detectives. And we look for these rare pathogens, and we try to help people and make sure it doesn't. But we talk about it a lot, and he asks a lot of questions, and I'm honest with him. The fear factor is something that we have to acknowledge and we talk about, and then we break it down. Like, what is it that is actually scaring you? Is it something that you're thinking is scary that I can help answer a question to? Or is it something, is it something that we know and I can help explain it? But I don't lie to him. You know, I tell him if I know something, and I tell him if I don't know something. But how I reassure him is that there are millions of people around the world that are working against this virus, and arguably billions of people around the world that are fighting against this virus, and we're in this together. So he didn't have a birthday party with his friends physically, but we had different Zoom parties. So we're just finding ways to make this work for us. You know, we are on a bit of a roller coaster, and it has twists and it turns and ups and downs, and some roller coasters go forwards and some go backwards, but we will get off this ride at some point, and we'll do it together. But we're very lucky that we have a really wonderful unit with my husband and the little one, and we just do our best every single day. I don't have any magic stories. I don't have any, we do our best every single day. But we talk a lot about it, and when we don't want to talk about it, we play. So that's what we do.
Thank you, Maria. Mike, maybe you can answer the next one. I know your kids are a bit older, teenagers, but if you had younger children, or if your kids were younger at this moment, how would you explain to them why did COVID came in the first place?
For me, and I'm trying to think, the quote on this, I think it was Margaret Mead, who said that children should be taught how to think, not what to think. Yeah. So I think that's, I wouldn't even try to sort of give a blow by blow, this is what you need to know, because I don't think that's how my kids would certainly absorb information. I think they need to know what they should be thinking about, where they need to go and get their information. I'd more ask them questions and then have a dialogue, like I said before. So I think there's too much talking at children, particularly youth, and that just doesn't work. So no, I would. I think the other thing that I think, particularly with teenagers, is I sense that there's this perception that teenagers are selfish, and they're going through their selfish phase, and people are locked in the rooms and don't want to engage with society, and this sort of mantra builds up, and I don't think that's true at all. And I think that's what you have to, I try anyway in my relationship with my kids, is to really to try and access that place of compassion, altruism, looking out for others, putting themselves in the other's place. One of the things I think in youth, and we were all young, what did they say, that adults are just outdated children, So when you look back, and we all look at that, and people talk about the selfishness of youth. Well, it's not selfishness of youth. There's an absorption about youth, because you're experiencing a lot of things in your life for the first time. And you resent when you can't experience those things. And how many kids this year have missed their school tours, or they've missed a school trip, or they've missed the school show, and they can't. My daughter, Circa, they were supposed to put on the big school show this year, and drama queen that she is, that's a big thing, because they had a big plan for that. You have kids in transition year in school who get to travel in different parts of the world and they're not getting that this year, or do work experience. So, it's not about the selfishness of youth. It's that very often as a younger person, you're experiencing things, big things, for the first time in your life. And you really commit to them. And okay, that may look like selfishness, but it's not. It's the way we learn to be adults. But there isn't a teenager I know that won't sit down and have a good conversation around their responsibilities and what they need to do and their power to be activists and to turn that around. And I'm seeing that more and more. But I think we have this, I think adults or older people have as many prejudices about how youth think as youth have about how older people think. And that has been there forevermore. We need it because obviously we need new arts and we need new visions for the future. And the way society actually develops is the young generation is essentially supposed to programmed to think that the last lot had it all wrong, right? That's part of how society evolves. That's where the innovation and the creativity and the desire for better, fairer systems come from, is the hope of youth and the desire of youth for something different. And the day that stops, I'll be very worried. The day the youth become some facsimile of the previous generation will be very dangerous for human civilization if that ever happens. The problem is, in an outbreak of COVID, we've got to come together. We've got to find a common way to do things for a little while. And then the youth can go back to challenging everything about the previous generation, which they should. But I think we need to find, and that's what I try to find with people, youth groups and people I've spoken to my own kids, is can we forge an alliance around this? This affects all of our futures. And this has a profound impact on the lifespan of an 80-year-old neighbour and your long-term education and your mum or dad's job. Everything is at stake here. The whole of society is at stake. It's all of us. So we need to find an all-of-us solution, which we all can contribute to. It's not them and us. It's not over there and not over here. It's all of us, it's everywhere. And I think, and I've seen a massive response from youth around that issue. I've certainly in my own country, when everyone went back to college, there were all these house parties and it was kind of hero activism stuff. I'm having a house party, Now I think people have changed and they've said, hang on, what, you're having a house party? What kind of lunatic are you, And that's changed over a couple of months. Yeah. And I think people have kind of woken up to, is it really cool? Is it that cool to have a house party and bring 100 people to it and be there for hours and have any number of them go home at the weekend to their parents or their grandparents and pass on a disease? Is that cool? Is that really what we should be aiming for? And I think that's what youth themselves have decided. Hey, that's just plain stupid. And I think, but I think younger people need to make their minds up for themselves on that. And again, I'm back to what I said at the beginning. Don't tell people what to think. Tell them, teach them, show them how to think. And I think I have great faith in the youth. They're doing it.
I see it with my son. When we talk about these different actions of washing your hands and wearing the mask and school and the physical distancing, he'll point it out to me and to others, that and he told his teacher on the first day, I'm very sorry you're not wearing your mask right. And I was like, oh, don't do that. but the honesty, I know. But he meant it in a kind way. But I think we're seeing. I do. But the behavior change. The kids are doing it, and they're seeing it, and they're seeing. If you see images of children in school, you see them at their separate desks. You see them doing different things in the lines. And when you ask the question that was asked before about the behavior change and doing all that, we're seeing it happen. I mean, we're now almost a year into this, and there are things that are taking hold in terms of our everyday. And I think that will come, but it's hard. It's hard to uproot your life and do everything different, but these are little things that we can manage.
Thank you very much. There were questions coming. Parents were sharing that kids are asking why everyone is not wearing a mask. On the other side, they were also asking, why do we need to wear a mask in schools? It's uncomfortable when we are playing on the ground. And one more question that came that I thought it's that some kids are scared. And what I'm gonna do if you and daddy get sick. So this is another question and fear that kids have shared.
I think that last one that you mentioned about what happens if my mommy and daddy get sick. I mean, we've talked about, my husband and I have talked about this because we live in Switzerland and our extended family is not here. I know many people would come and offer help for us, but make a plan with your family. You know, you've heard me say make a plan before, but make that plan with your family and really kind of talk through some of the situations that you may experience. If somebody feels unwell, if somebody is sick with COVID. But, you know, we live in the Northern Hemisphere and we're in an area where there could be other things circulating. People have allergies. You could have the common cold. There's many reasons why you may be sick. It may not be COVID, but make a plan. You know, and talk it through with the kids. But I wholeheartedly agree with Mike on the not talking to, talking with. And with the youngest kids, the really, really little ones, drawing pictures, you know, doing different things through different ways to communicate, to talk about some of these things. We have an image on our refrigerator, and Cole calls it the COVID passport. And it's a picture of the virus that he drew, and it said, you know, that it was traveling around, and so he was mentioning different countries, and these are different ways in which we can talk about some of these different things, but do the best you can. I mean, do the best you can.
Yeah, and the issue with masks is important because there's a perception that masks, and something that masks are the answer. They're a huge part of the answer, particularly in areas of high community transmission. But if you're living in somewhere like New Zealand today, or you're living in another country with very low incidence, you may not need to wear a mask in normal life. So the mask guidance and even the physical and social distancing guidance is very dependent on the local transmission. So if we work hard, and this is the bonus in a sense, the lower the level of community transmission, and if, like some countries, you get to zero transmission, in New Zealand a couple of weeks ago, there were 47,000 people at a rugby match. You know, it's not impossible because they crushed the virus. So I think this issue of when you're left in a situation of intense community transmission and your intensive care units are full, the government have to take out all of the options, and everyone has to wear a mask everywhere, and no one can go anywhere, and everyone has to stay home. That's a consequence of the virus taking control. The more we take control, the more we can lift those sorts of restrictions. And for example, now with masks, many countries are even saying you have to wear a mask outside. In any situation, because it's not that they believe that the disease is flying through the air in a field. They're just trying to drive home this idea that we're in such a bad situation that we need people to mask almost all the time because we're so afraid of transmission. And I think that's part of the problem that people have. Just on the issue of kids, it's really important that we don't underestimate or in some senses dismiss the concerns that kids have. We need to talk about these things with kids, specifically young kids, and kids have these fears, and there's nothing more devastating in the life of a child than a sick parent or a death of a parent. I lost my own dad when I was 11, and it's horrific, and I saw my younger brothers and the pain they went through in that process, not understanding. And, you know, this is not fair. What have I done? And centering the blame on themselves and feeling in some way guilty about things. So kids process things in strange ways. They often turn that in on themselves. So it's really important that it stays open, that kids are allowed to express their fears, that they're allowed to articulate those. They find ways that, as you said, even the youngest of kids can find artistic and other ways to do that. It's really important that that's kept open. And that it's not pushed to the side. And then that you can be rational in reducing their level of concern. And that's really important too. It's not just about having the fear out there, it's about helping them to manage that, giving them again the right information and allowing them, giving them skills in how to process, activities in which they can process those concerns. It's real. And a lot of kids in this have lost grandparents in this response. And a lot of, I know kids who have lost grandparents that they didn't see for 3 or 4 months, people who were really close to. All of you out there, I mean, think of that one grandparent, that really special person in your life. And I think there's quite a bit of trauma out there amongst kids who are grandkids, not just of the children of older people who died, but the grandkids of older people that died. And and there's a reckoning that comes with that as well. So the grieving process for kids, it's tough because you don't have all the natural things, the funeral situation, you don't get to say goodbye, you don't have the gatherings. So it's grieving interrupted, and we need to look at that because there is a process that we all go through in grief. And that's being interrupted by the COVID just as much as our social activities are being interrupted. And quite frankly, I'm not so concerned if my ability to go to the pub and have a pint is interrupted. I am concerned if a child's need to grieve the loss of a grandparent has been interrupted, because that can have a lifelong impact. So I think we need to think about how we allow kids both to feel fear, to grieve and do all of these other things, and also to be part of the solution, because they're a powerful part of our society.
So it's again, Mike, as you said earlier, thinking about consequences. So Maria, having in mind consequences, how we can protect ourselves, our kids, but also to set a good example for them, can you summarize once again, what do we have in a toolkit to fight this virus?
I keep thinking of this image. I keep thinking of we bought this book once with my son. I think he was 5, and it was called Be a Superhero, and there were little things you could cut out and wear a mask, and we each had capes, and we have this image of us, and we're silly in some Sunday morning or something, dressed. And I keep thinking of this over and over and over again, especially with kids, to be your own superhero, to use these tools that we have. So whatever it is that makes you feel powerful, however old you are, dress up as that superhero figuratively or literally, and use the tools that you have. We do have tools, Alex. We have physical distancing. We have masks. We have hand gel. We have soap. We have water. And there's a huge global effort to make sure that we have soap and water all over the world so that people can clean their hands. We have the ability to open windows and doors, and in many situations to improve natural ventilation in the rooms that we are in if we are indoors. We have information, and we have good information. There are good sources of information that exist all over the world, whether it's through WHO or your local authorities. Find that good information, push out that bad information and that negative information. That's really important for our mental health. And we have information about not only where the virus is, but what are risky behaviors and what are the things that we can do to minimize those risky behaviors. And many of us, not everybody, but many of us, we have the power to make decisions. So these are the tools that we have every single day. I may be forgetting some of the individual tools, so remind me if I've forgotten some, but I just keep thinking of all of the different things that we can. We have powerful tools right now that make us the heroes and make us become the superheroes fighting against this virus.
Thank you very much. We went over the time, but I really appreciate your effort and time to answer all the questions. There were many more, but I had to select, and especially those that were coming from kids. Many viewers are watching us from many countries. I'll name a few: Turkey, South Africa, the USA, India, Denmark, Sweden, Russia, Romania, Azerbaijan, Mali, Ghana, including DRC, Peru, Zambia, Bosnia, Botswana, Argentina, Canada, Germany, Thailand. So it's really west and east, north and south. So we thank you everyone for watching us. We thank you everyone for your questions, and you've heard Maria and Mike what we can do to end this pandemic, and that we are in this together. Until next Wednesday, stay safe.